Hello, my name is Sarah. I'm with Oklahoma Healthcare Authority. I'm a provider education specialist. This is the Patient-Centered Medical Home PCMH Essentials class for spring of 2020. This class is designed for current and prospective members, and we will discuss the components of maintaining a patient-centered medical home and required screenings, coverage, incentives, and other helpful tools and tips. This information in this presentation is current as of April 2020 and is subject to change. Stay informed by signing up for web alerts on OHCA public website at okhca.org/webalerts. Today we're going to talk about the overview, PCMH essentials, additional requirements, incentives and reports, reminders, and resources. The PCMH is an establishment of a relationship between a medical home provider and a Sooner Care member. And OHCA also provides outreach and education to members on the importance of establishing a relationship with their medical home provider. Primary care providers are responsible for managing the members' basic health care needs, including specialty referrals and after-hours care. And each PCP is prepaid a fixed monthly capitated payment for care coordination. All additional services are paid under the fee-for-service system. OHCA contracts with qualified primary care providers, and all providers serving as PCPs must have a valid Sooner Care fee-for-service contract, as well as an Exercise Sooner Care Choice addendum. All PCPs, excluding provider or physician groups, must agree to accept a minimum capacity of patients. However, this does not guarantee a PCP's minimum patient volume. Physicians are limited to 2,500 members on their panel. Advanced practice nurses and physician assistants are limited to 1,250 members on their panel. Provider agrees to accept a minimum capacity enrollment and may not exceed 2,500 members per physician participating in the group. If a licensed physician assistants or advanced practice nurses are members of a group, the capacity may be increased by 1,250 members if the provider is available full-time. The provider or physician groups must also designate a medical director to serve as the primary contact with OHCA. Applications for medical home provider can be found at okhca.org/medicalhome. You can choose from entry level, advanced level, and optimal level. There are some common mistakes to avoid when you are submitting a PCMH contract. Using an old application form is one of the main ones. Make sure you go to okhca.org/medicalhome and click on the most current to fill that out. Also adding incorrect programs such as Insure Oklahoma when only Sooner Care Choice is needed, and changing contracts without advance notification to OHCA. This can cause issues with the 15-month look back at the PCP encounters. Also adding a DEA and CSR for individual practitioners and groups, PCP disenrollment letters and not notifying the panel members, and also advising the members to choose an individual provider, but if the group is the PCMH, the member needs to select the group instead of the individual. There are 3 tier levels: entry level, advanced level, optimal level. Entry level must meet 11 base requirements. Advanced level must meet 14 base requirements and 3 additional requirements. Optimal level must meet 20 base requirements, and there are 3 additional requirements that are optional. This is a quick look at Tier 1, Tier 2, Tier 3, also known as entry, advanced, and optimal level. We'll discuss these further in the presentation. Hours of operation. The minimum hours a provider needs to be open for entry level is 20 hours per week. Advanced level is 30 hours per week. Optimal level is 30 hours per week with an additional 4 hours outside of the hours of 8 to 5. The PCP is responsible for coordinating and delivering preventative and primary care services, which are medically necessary to all Sooner Care members enrolled with him or her. Preventative performance and tracking guidelines can be found at okhca.org/medicalhome. And as you see, the Adult Preventative Performance Tracking Audit Guidelines and Child Adolescent Preventative Performance and Tracking Audit Guidelines are there for your use. Adult preventative services are limited to heart health, cancer screening, annual health risk assessment, sexual health screening, and immunization. Child and adolescent preventative services includes, but it's not limited to, the periodicity schedule we use is Bright Futures EPSTT periodicity schedule, comprehensive health and development history, physical exam, immunizations, labs, and health education. Oklahoma is also a universal screening state for lead screening. Children should be tested at 12 months and again at 24 months of age. Medical home providers should give verbal or written anticipatory guidance to the parent or guardian at each well-child exam through the age of 72 months or 6 years. For members under 21 years of age, the record must include a complete history of immunizations and an appropriate history for adults. The provider must provide an OSIS PIN number and submit data to OSIS as appropriate. All vaccines administered should be fully documented in the patient's permanent medical record and updated during well-child visits. As per the requirements of the National Childhood Vaccine Injury Act, the best practices, the documentation should include all of the following. An administration fee will be paid for vaccines administered by providers participating in the Vaccines for Children's program. For vaccines administered as part of the VFC program, only one administration fee is permitted per vaccine, regardless of the number of vaccine toxoid components in the vaccine. Payment will not be made for vaccines that are covered by the Vaccines for Children program. When the vaccine is not included in the program, the administration fee is separately payable. The appropriate HCPCS code and National Drug Code must be billed. In addition to the NDC and HCPCS code, claims must contain the drug name, strength, and dosage amount. Clinical data provider agrees to organize clinical data in a paper or electronic format as a patient-specific charting system for individual panel members. Provider agrees to maintain a medication list that is updated during each visit. It must include supplements, over-the-counter, herbal, prescribed, medications prescribed by other practitioners, name, dosage, frequency, quantity, start and stop dates. Your lab test and diagnostics testing, referral tracking. Provider must maintain a written policy and procedure, which includes a step-by-step process of all diagnostic testing, referrals, and procedures, and it'll designate the tracking frequency and the staff that is assigned to maintain and oversee that process. Care coordination. The PCP must follow through all of the diagnostic tests, referral, behavioral health screenings, procedures, including initial orders, ongoing tracking, consult reports, ordering providers' actions to address the results and outcomes. Care coordination as of October 2019. The following rates reflect the PCMH level and appropriate age groups. Entry, advanced, and optimal level, and whether you see adult only, child and adult, or child only. Providers responsible for supplying the patient and family education and support utilizing varying forms of educational materials to address the individual needs and medical conditions and to improve understanding of the medical care provided and a plan of treatment. Provider must enter a note in the member's record of what materials were given. A medical home agreement is an agreement between a member and a provider to focus on meeting all of the patient's healthcare needs. It explains and defines the roles of the member and the provider and as part of the medical record. The provider or designee and member must sign and date at the same time. Signatures must be original, no stamps or copied signatures are allowed, and a copy must be stored in the patient record. You can find a copy of the medical home agreement at okhca.org/medicalhome. It's available in English and Spanish. Open scheduling. We want our providers to use the scheduling process to promote continuity of care. Open scheduling is defined as the practice of having a at least 15 minutes. This does not include double booking appointment times. These must be separate from your normal appointment for same day or urgent care appointments. The provider must also have a written triage procedure for the scheduling staff to follow. E-communication, OHCA has been green for a long time, so we want you must accept electronic communication from OHCA in lieu of a physical hard copy. So please update your fax numbers and email addresses and keep them current. And the provider is responsible for updating that information using our secure OHCA provider portal. 24/7 phone coverage. This must happen 24 hours a day, 7 days a week. You must provide an opportunity for the member to speak directly with a licensed healthcare professional. The number to call should connect to a person or message, which can be returned in 30 minutes. And all calls are triaged and forwarded to the PCP or on-call provider when necessary. This coverage includes after office hours, weekends, vacation coverage, and the provider also needs to maintain a formal professional written agreement with the on-call PCP or providers, and notification is shared relating to panel members when needs and issues arise. Behavioral health screenings are required for panel members age 5 and older annually. You bill code 96160 in addition to any other services that are provided during that time of visit, and reimbursement for this procedure is paid on a quarterly basis at $5 per screening as a Sooner Excel initiative. Medical home providers are required to coordinate referrals to the appropriate specialist if the member has a positive screening. You can find the screening guidelines and screening tools at okhca.medical/medical home. Maternal depression screenings have been added to our list of covered procedures. They can be performed at the 1, 2, 4, and 6-month well child EPSDT visits. We allow the reimbursement of the maternal depression screening billed under the child's ID number using CPT code 96161, currently reimbursed at $5. Any screening tools that you need or follow-up can be found at the link below. We have additional requirements that are required for advanced and optimal levels. So for advanced level, you must have Tier 1 entry-level requirements, plus have an open scheduling for a minimum of 30 hours a week, and track panel members inside and outside of your practice using our provider portal. You can use the roster data, patient utilization reports from ER, inpatient admission, discharge reports, eligibility, last dates of EPSDT, mammograms, etc. We also want you to provide transition care coordination, follow-up for any services or care received by the member in any outpatient or inpatient facilities. Make sure it's documented in the member's record and on the problem list. Multimodal communication. You communicate directly with the panel members through a variety of methods, phone, mail, text. More additional requirements. 3 of the following 5 are required for advanced, and all of the 5 are required for optimal. We want your healthcare team to be led by a PCP that provides ongoing support, oversight, and guidance of all medical care received by the member inside and outside of the PCP's office. Documentation is required. Post-visit outreach for an acute or chronic visit includes phone calls to monitor medication changes, weight checks, blood glucose, blood pressure monitoring. Using evidence-based clinical practice guidelines such as AAP, AAFP, CDC, and more. And also offer a minimum of 4 hours of aftercare outside the hours of 8 to 5, Monday through Friday. These hours should be posted as part of the office hours. Also, a provider can use a medication reconciliation process to avoid interactions or duplications such as Epocrates, e-prescribing, SoonerScribe, Produce software, or screening for drug interactions. The following are required for optimal level, which you must have Tier 1 and Tier 2 entry and advanced level requirements, plus you must use health assessment tools, other disease and high specific risk assessment tools. The optional additional items you can have for optimal level are a secure interactive website, which would be a patient portal to maximize communication with panel members, integrated care plans for members who are co-managed with specialists and other healthcare disciplines, and performance improvement reports measuring performance for quality improvement using national benchmarks for comparison. The Sooner Care Choice PCPs may receive the following incentive payments. Care coordination is paid monthly. Sooner Excel initiatives are paid quarterly. FQHCs and RHCs are not eligible to receive care coordination or Sooner Excel payment. A care coordination payment is made for each member who has established care with their assigned PCP within the last 15 months. It is verified when a claim is submitted, and that would be based on a paid claim. And it applies to both Sooner Care and Insure Oklahoma members. Care coordination payments vary according to the type of members, the PCP services, and their level of medical home status. That was in the little chart earlier in the presentation. Care coordination payments are made by the 10th working day of each month for all eligible members enrolled with the PCP on the first day of each month. The single monthly payment is generated and accompanies the care coordination listing or is deposited directly. Incentives and reports to verify established and non-established panel members. The member initial visit report will show results for both categories, and the capitation rosters will show zero payment if no relationship is found within the last 15 months. Clerks must have the financial role to access this report. You would log into the Sooner Care Provider portal, use the Financial tab, CAP Reports, Member Initial Visit Report, and Report Copy. Here's a screenshot of what that would look like. And then when you pull up these results, this is what your Member Initial Visit Report will show. And you'll see that there's Sooner Care Choice and the public product of Insure Oklahoma as well listed on here. And then here's a screenshot of how you would pull up your CAP report using the Financial tab. And as you see here, there are some amounts paid that say zero. Those are the ones that have not had an initial visit within the last 15 months. The Sooner Excel initiative payments are based on well-child EPSDT visits, behavioral health, ORTH-DTaP, breast and cervical cancer screening, ER utilization, physician inpatient admission. You can find those reports under the Letters tab. Use the drop-down and choose Sooner Excel. And then this is your Sooner Excel Provider Incentive Payment Letter, and it'll tell you how much you got for each incentive. If you want additional Sooner Excel payment methodologies, you can go to okhca.org/SoonerExcel. A few reminders: always use current application forms. Notify OHCA in advance when changing contracts. Notify your panel members when a provider is disenrolled, and advise member to choose the correct PCP based on how you are contracted, either group or individual. Always sign up for web alerts. This will help you stay up to date on the most current changes happening at the Healthcare Authority. A few resources if you need on-site training or virtual training. Contact Sooner Care Education at okhca.org, either by phone or fax as well. In your request, please include the provider's name, Sooner Care ID number, a return phone number, and a contact name. You can also reach out to OHCA Provider Services, your Internet Help Desk, our public website, the medical homepage and provider enrollment page, and also the Childhood Lead Poisoning and Prevention Program. Thank you very much for attending. Have a great day.